Good afternoon, I'm Vashan Brown with the Midday News. A special welcome if you're watching on onespotmedia.com. As Jamaicans prepare for an Easter weekend lockdown, Chief Medical Officer Dr. Jacqueline Bisesa McKenzie has issued a strong warning to citizens to desist from breaking the curfew orders. Over 100 people were charged for breaches of the Disaster Risk Management Act during last weekend's lockdown. Dr. Bisesa McKenzie insists the curfews are important to curtail the rising cases of COVID-19 in Jamaica.
This weekend in particular, people stay at home. People reduce their hours out on the road, reduce their going into any kind of crowded situation, wear their mask, keep physically distanced from others, and if you are sick, stay at home.
That warning from Chief Medical Officer Dr. Jacqueline Bisesa McKenzie at this morning's COVID conversation. The warning comes following a spike in cases last year over the Independence and Emancipation weekend.
In August last year, we had a triggering activity in terms of the holiday week and the events that followed, and this resulted in a spike in the number of cases. Right now, in this long holiday weekend, we are at a considerable risk of increased exposure if the number of persons on the road and in the shopping areas, in the recreation areas increase. We face the risk that this could be a triggering weekend, with the result that in another 2 to 4 weeks we would see our numbers going up.
The CMO says that would not be a good thing for the country, as analysis of the COVID data is now showing a plateau.
This is what our epidemiological curve looks like in blue, where we will see that the 8th of March, we see what looks like a peak. It is too early to say really that we are going down in terms of the number of cases. What it appears is that we may have reached a plateau, but certainly we don't think that there is a downward trend yet, but possibly a plateauing in the number of cases.
In the meantime, she notes that hospitalizations and bed space continue to be a challenge.
In terms of bed occupancy, we will see that in the blue line that the bed occupancy is follows the positivity rate, which is in green. We can see the positivity rate has gone up and is plateauing, and the bed occupancy and the deaths are following that same trend. The red line indicates the number of beds that have been allocated for COVID care, and we would have seen that over time we have gradually increased our capacity. We are now at a capacity where we have approximately 600 beds that are dedicated COVID beds. What we would see in the blue is that we have gone over that in terms of hospitalizations on a daily basis for the last couple of days, probably about 2 to 3 weeks. We would see that our numbers in terms of actual persons on beds are more in the region of about 700.
O'Shane Masters, TVJ News.
In the meantime, 306 new cases of the coronavirus were recorded on Wednesday. The number of confirmed cases now stands at 39,543. Kingston and St. Andrew recorded most of the new cases with 129, followed by St. Catherine with 88 and St. James with 22. Meanwhile, 429 persons remain in hospital. 52 are critically ill. There are 20,950 active cases of the coronavirus in Jamaica. In the meantime, 3 more Jamaicans have died from COVID-19. These include 2 from St. James and 1 from Portland. Now, one of the cases from St. James, that of a 33-year-old woman, was previously under investigation. This brings the death toll to 599. 121,000 doses of COVID-19 vaccines are expected to be in the island between April into May. Chairman of the National Health Fund, NHF, Howard Mitchell, says the doses should be sufficient until the supply chain of vaccines stabilizes. In a statement, the NHF said 75,000 doses of AstraZeneca vaccine from the African Medical Support Platform are expected in the island in the next 4 days. 20,000 doses of the Moderna vaccine from commercial sources are expected to arrive 2 to 3 weeks later, followed by 26,000 doses of the AstraZeneca vaccine under the COVAX facility. Mr. Mitchell says under these agreements, Jamaica has been allocated sufficient vaccines to inoculate 1.5 million citizens. The Nurses Association of Jamaica, NAJ, is warning that the call for extra nurses at the University Hospital of the West Indies could encounter hurdles due to regulatory issues. As you'll hear in this report from Sandy Williams, NAJ President Patsy Edwards Henry says the volunteering of nurses must be in compliance with the legal framework.
The University Hospital of the West Indies made a public call this week for assistance from volunteers and retired nurses to deal with the increased patient load brought on by COVID-19 and the loss of staff at the facility. While persons may be willing to answer the call, the Nurses Association of Jamaica, NAJ, has pointed out that there could be challenges due to regulatory issues. NAJ President Patsy Edwards Henry cautions that any volunteering by nurses must be in compliance with the legal framework. She explains that if nurses are to volunteer, they will not be able to carry out certain duties unless their registration is current.
We have to be careful because nurses have to be registered with the Nursing Council of Jamaica in order to administer care. So while we can have persons to volunteer to do probably assistive tasks, we can't have nurses volunteering to work and to actually do the care and go into the detailed care that the registered nurse would do without being registered by the Nursing Council of Jamaica.
Mrs. Edwards Henry adds that deep consultation and discussion are first required in order to solve the nursing shortage.
It can be if we have collaboration and if we have dialogue. But as he said, a lot of these processes take time. We make the call every single day. This is not a one-time call. We call the ministry, we call the region, we call them on a regular basis. When is this person going to be employed? How many can we employ? And we are set limitations. We are limited in our scope. So the NAJ is constantly lobbying to get more nurses in. And we are always told that they have to work within their budget.
Sandy Williams, TVJ News.
The government says the e-commerce national delivery system ENDS will be extended to Montego Bay, St. James and Kingston come tomorrow, Friday, April 2. The program, which was launched in Portmore St. Catherine last weekend, will now include grocery stores and pharmacies in that locale. ENDS is designed to enable the quick service industry to continue operating during the hours of the curfew by facilitating online delivery orders only. It is expected that the online registration portal will facilitate full automation by Wednesday, April 7. In the meantime, the government says registration of businesses and vendors for the program is ongoing, and customers may view the current listing of approved vendors on the portal's official website, which is ends.gov.jm. And it's now time for a break, but please stay with us. More stories when we return. Welcome back. Continuing the news now. Former Commissioner of Police Owen Ellington wants Jamaica's criminal justice system to be revised. Speaking earlier on the morning agenda on Power 106, Mr. Ellington said the laws do not match the level of criminality the country is currently experiencing. Here's Sandy Williams with more.
The high levels of violent crimes in Jamaica remain a major concern, and the calls for the government to address the crime problem are growing louder. Speaking on the morning agenda on Power 106 on Thursday, former Commissioner of Police Owen Ellington argued that legislators have failed to establish laws that match the level of criminality currently in the country.
Over the years, we have softened the approach, the approach to treatment of offenders by several amendments to the laws, but we have not actually enacted the kind of legislation that really push back at the wave of criminality that we've been experiencing.
Mr. Ellington said, unless the country returns to using the criminal justice system to send strong messages to criminals and rehabilitate offenders, there will be no impact on the crime problem.
The criminals are actually making a rational choice about the crimes they hit, what likely punishment they would face if they are caught, tried, and convicted. And they balance that against the benefit they get from committing the crime, the immediate benefit from the crime. And when they look at the kind of sentences that people are getting, the rate at which offenders get off criminal charges, the short space of time that people spend before they get parole, when they look at all of those factors, it gives them the impression, and members of the public get this impression as well, that it's easy to commit crimes in Jamaica and get off of it.
Sandy Williams, TVJ News.
There are calls for the resumption of the death penalty in Jamaica as a deterrent to violent crimes. Now, the calls come as citizens have grown tired of the high levels of murder. But attorney at law Isaac Buchanan, speaking on the Morning Agenda recently, says it's not that easy.
1988 was the last time somebody was sentenced to death or put to hanging. And there's a reason for that. Our government simply cannot do it without sanctions from the international community. Our Prime Minister came 2 days ago and said, I am going into the international market to beg money. The very people we are begging from says they are anti-death penalty.
That person was Nathan Foster, who was convicted of murder and hanged in February 1988. In relation to Kenise Jackson's case, the 20-year-old accounting clerk from Portmore St. Catherine, whose body was found last Friday, Mr. Buchanan says it's unlikely that Robert Fowler, who confessed to the crime, will get a 50% reduction in his sentence.
Any judge that sits on this case, respectfully, the particular case that's causing this discussion, is not likely to give a 50% discount, notwithstanding that this man is going to plead guilty on the first occasion. So either a judge in her experience looks at all the circumstances, and there are things we need to question, what makes a 50-year-old man get up and commit a heinous crime like this? What are the mental implications? And a judge is going to do that assessment.
He, however, says fixing the country's crime problem is not an overnight event.
It's not a band-aid. And I'm saying be mindful of how you are going to clog the court and deter persons from accepting responsibility and making amends for the wrong that they would have done in situations that we do not know.
Changes are this afternoon being recommended for the Child Care and Protection Act as well as the Adoption Act. These recommendations come from the Caribbean Policy Research Institute, Capri, which released a report on Wednesday called Fix the Village, Governance and Accountability for Children in State Care in Jamaica.
So the Child Care and Protection Act should be reviewed immediately. And these reviews should both take into account evidence-based research as well as the voices of the children.
In response, State Minister in the Youth Ministry, Robert Morgan, says he will not challenge the report. He says though there are issues in the system, his focus is on reform. He says the government is moving ahead with plans to make changes to the Child Care and Protection Act, CCPA.
A draft cabinet submission is ready for submission to cabinet regarding the amendments to the CCPA. You would recall that in 2013, Senator Kamina Johnson-Smith tabled a private member's motion in the Senate calling for amendments to several pieces of legislation related to women and children, and involving out of that, a joint select committee was convened, and it took a couple of years. Also, the UNICEF and CPFSA were having a process of reviewing the CCPA as well, and both those processes came together, and what it has resulted in is a cabinet submission that I have in my possession.
He also said the changes to the Adoption Act is a top priority for his administration. Now, the Capri report highlighted several weaknesses in the country's state care system. Capri said monitoring, oversight, and governance issues are resulting in poor outcomes for children. After 7 weeks of missed sittings due to COVID-related issues, the Ministry of Labour again faced Parliament's Public Accounts Committee PAC on Tuesday. Representatives were questioned about cash cards and deceased path beneficiaries as presented in a report. Here's Herman Green with that story.
The report from the Labour Ministry details issues with 1,823 cash cards through which beneficiaries of the PATH program access financial grants. The report stated that 360 of these cards had expired and were replaced, and 141 were recalled because of a card sequence banking error. However, PAC members questioned why almost a third of the cards which had been cancelled were classified as reasons unknown.
How do we move forward in a scenario where you don't know the reason why somebody's card is either not working, gone? What does the ministry do in a scenario like that?
Right. Well, Chairman, we still investigate, but in many instances, we then convert the beneficiary from the card back to a check payment or one of the other modalities that we have.
The report accounting for deceased beneficiaries also raised questions.
Again, one parish seems particularly high. Clarendon, 79 of the 81 deceased there. Members, any?
But, Chairman, on that same point, is it that the social worker in Clarendon is more efficient than other areas, or is it that we have had greater deaths in Clarendon to account for this here?
All the other parishes, the disease is 0 and 1. And then for Clarendon, it is 79. And for Clarendon, no card has expired, 0 card has expired.
However, the Permanent Secretary explained that the report was prepared based on queries about monies left unused on 1,823 cards for unusually long periods of time.
What ensued from the 1,823 was to try and determine what were the reasons persons did not use the card or collect their monies. And so what is provided is the report that the Public Assistance Division in the ministry would have provided to me.
The committee has been asked for verification of the data at the next sitting.
The Statistical Institute of Jamaica is reporting that the Jamaican economy contracted by 8.3% in the fourth quarter of 2020 compared to the corresponding quarter of 2019. Statin says this was largely due to a decline in the services industries, with the exception of the government services, which grew. Now, Statin also noted that the measures implemented to limit the spread of COVID-19, as well as the decline in the global travel industry, had a significant impact on the services segment of the economy. Preliminary estimates showed that the economy contracted by 9.9% for the 2020 calendar year. There's a slight reduction in the number of road fatalities since the start of the year. 85 fatal accidents have so far led to 100 people being killed, but there is still a cause for concern.
This is nothing to celebrate, because we lose 100 people unnecessarily due to road traffic crashes.
There have also been accidents resulting in fatalities during curfew hours. Director of the Road Safety Unit, Canute Here, believes indiscipline is a major contributor.
Yeah. But at the same time, we have 29 persons who have been killed in road traffic crashes during curfew hours.
And it's now time for sports. Now at sports time, West Indies had reached 105 for 2 in their second innings against Sri Lanka on day 4 of the second test in Antigua. The Caribbean side leads the visitors by 201 runs. Now earlier, Sri Lanka, who began the day on 250 for 8, were bowled out for 258. Kemar Roach took the wickets of Patham Nisanka and Vishwa Fernando to end the innings with figures of 3 for 58. Alzari Joseph and Jason Holder took 2 wickets each. Scores in the match so far: West Indies 354 and 105 for 2, and Sri Lanka 258. Now, the first test ended in a draw. If the West Indies defeats Sri Lanka, then they will move up to 7th in the ICC Test rankings. And that's the Midday News. I'm Vashon Brown. Join us at 7 for Primetime News Package. On behalf of the news, sports, and production teams, have a wonderful holiday.